Thank you.
Fan, by the way. I am. Right here. What's up? Reason number 2 why this event, hey, how you doing? Why this event is unlike a Today Show event. We've never said anal sex. So this is all new to me. Kind of like this. Anyway, moving along swimmingly, because that was smooth. I want to introduce you to essayist, journalist, and actor David Rakoff, who will be presenting this year's Research in Action Award to Dr. Tripp.
That's weird, because I was actually on weekend today and I had anal sex.
That's awkward, because I was there too.
Tripp Gulick is, I really should have written down what I was going to say. Tripp Gulick is the first Tripp that I ever met. And as such, he really colored all associations with that name for me, which was good, because in the subsequent years I've met quite a few Tripps, and they're exactly as you might imagine them to be, you know, sort of Phillips Exeter lacrosse playing neoconservative, cravat swing word douchebags. And every time I meet them, I'm just predisposed to like them because of Tripp and those characteristics that I associate with him, which is you know, this fierce polymathic intelligence and great good humor and an abiding love of show tunes, which is an aberration in this room, I'm sure. And a kind of a quiet heroism that, you know, Gary Cooper, frankly, couldn't manage at his most high noonish. And so he really set in stone what the name Tripp means to me, and it's because we met when we were so young. He was a medical student, and I was a senior in college, and I think it was all 20 or 21 years of age. So it's doubly astonishing to see what he's accomplished in the 8.5 years since that time. But I did want to read some of his accomplishments, and I actually have to have them written down for me because they are manyfold, and the words are big, and I actually I took an OxyContin before I came. I really did, actually. Tripp Gulick is among a select group of infectious disease specialists who both conducts research and also has a clinical practice. He is the chief of the Division of Infectious Diseases in the Department of Medicine and professor of medicine at Weill Medical College and attending physician at New York Presbyterian Hospital. Prior to this, he was the director of the HIV Research Clinic at Bellevue and medical director of the Virology Research Clinic at Beth Israel Hospital in Boston, which I sincerely hope is nicer than that dump Beth Israel in New York. Oh, come on, it really isn't dumb. His research interests include designing, conducting, and analyzing clinical trials to assess antiretroviral drugs with new mechanisms of action, refining antiretroviral therapy strategies, and testing immune-based therapies. Tripp is the principal investigator of the Cornell Clinical Trials Unit, serves on several AIDS research and clinical trial committees sponsored by the National Institutes of Health, the Department of Health and Human Services, the FDA, is a member of the New York Infectious Diseases Society, the Infectious Diseases Society of America, the International AIDS Society, and the American Society of Clinical Investigation, among other organizations. He has taught at NYU School of Medicine and Harvard Medical School, which, if my parents were here and they heard those words, they'd blow you. Actually, just my dad, but through all this, through all the clinical and research expertise, is this incredible heroism and drive to really end AIDS. And Tripp, it is an honor and humbling, both as your friend and as someone who is of about as much use to society as a aromatherapy candle. I'm grateful that there are people like you in the world. And so it is my distinct pleasure to present the research, although there is no award. What do I do? Just, oh, there it is. The Research in Action Award to Dr. Tripp Gulick.
bad news. Your parents just walked in.
Your lucky night.
Thank you so much. David, thank you. What a cherished friend you are. Thank you for that. I was accepted to medical school in the fall of 1981, just after the first 5 cases of a new disease were described in 5 gay men in Los Angeles. As a young medical student, I walked the halls of Columbia Presbyterian Hospital, and I saw patients with this as yet unnamed disease. And I saw their rooms. They were often taped shut, with stickers on the door with skulls and crossbones saying, "Do not enter." And I saw the fear and the panic in the healthcare workers who would don essentially spacesuits to go in and see these patients. And I saw food trays left outside the door because everyone was too afraid to go inside. I stayed at Columbia Presbyterian as a young resident, and I took care of some of these patients who had the newly named disease, AIDS. And many died, actually, in the time that they were in the hospital with me taking care of them. I remember as a junior resident in the medical ICU, I admitted a guy who could have been my college roommate. We were the same age. He was short of breath. That night, he went on a respirator, and that night he died of AIDS, all within 24 hours. I knew that I had to help. I knew that I had to go into this disease right from the beginning. The challenges, the mystery, and the panic really led me towards it. And on a much more personal level, as both a hemophiliac and a gay man who was coming out of the closet at the time, I knew I wanted to do something for my community. One of my friends said to me, "Well, how big is your community? How many gay hemophiliacs are there?" To go and announce to people that you were going into AIDS as a young doctor in the late 1980s was met with a lot of concern. I remember I went to a prominent West Coast institution to interview for infectious disease training. The very first guy I interviewed with set me down, looked around, and said, "Look, you're a promising candidate. We'd like to take you, but you have got to stop talking about AIDS." Well, needless to say, I didn't stay there on the West Coast. I came back to a prominent New York program and found out that the chief of infectious disease there had pronounced recently on rounds that AIDS was God's retribution against homosexuals. So that was out, clearly. I ended up going to Boston and finding out how to take care of people with HIVs in Boston. And I was exposed for the very first time to clinical trials. And this was very appealing to me. It took the rigors of science and medicine, but it kept the positives of patient care. And I began to be involved as one very small cog on the big wheel of Harvard and doing some of these clinical trials. I was very excited about a new drug called DDI at the time. And then we did something that seemed revolutionary. We put 2 drugs together for the very first time. And it seemed to work maybe a little bit better than just one drug. Well, Boston got small for me. I came running back to New York, was at NYU for 4.5 years, and then Cornell for the last 12. And as a young assistant professor, I began to lead my own studies. And one was a little study called 035. Why was that study important? It was one of the first studies to put 3 drugs together. It asked a very simple question. If 2 is better than 1, is 3 better than 2? And the 3 drugs we used were AZT, the then investigational 3TC, and an investigational drug called Adinavir, one of the very first protease inhibitors. We knew almost instantly that something was different about using 3 drugs. And I remember quite clearly, 1 week into the study, one of the women we enrolled came back to the clinic, and she had suffered from profound fatigue, and she said, "Something's in those pills. I dug and weeded my whole garden, and I cooked dinner for the whole family. And I haven't done that in 5 years. What's going on?" And we pondered that. 2 weeks later, we had a guy who was confined to a wheelchair because of HIV-related complications. And no lie, 2 weeks into the study, he walks into the clinic. And the receptionist goes, "It's a miracle!" And it was a bit of a miracle. And we held our breath because we just couldn't be sure would these good effects last or not. We enrolled 35 out of the 99 patients on this very small pilot study. And I was a very young assistant professor. And because we enrolled the most patients, I had the privilege of presenting these results at a national AIDS meeting that was held in the spring of 1996. And I showed a graph that said that our patients that took 3 drugs, over 90% of them had suppressed their viral load levels below detection. They were undetectable. And there were about 1,500 people in the room, and there was an audible gasp because no one had ever seen results like that before. We got a lot of backlash. People said 16 weeks, you know, what are we going to do with that? But it turns out many other studies contributed and found the same thing, and this directly led to the profound changes in clinical HIV disease that we know from today. The death rate from HIV/AIDS declined by 2/3 from 1995 to 1997. It's one of the things that we will remember in all of our lives, one of the most profound things to happen in medicine, probably during all of our lifetimes. But it was a privilege to be a part of that, a true privilege. And we've accomplished so much in this field. Of course, we haven't accomplished everything. There are still some challenges ahead. But we were very, very pleased with those results. Working in this field is a complete privilege. You get to work with some just tremendous people. There are a number of people from the HIV Clinical Trials Unit at Cornell. I'd love you to raise your hands, because these are the people, yes, I see you back there. You cannot imagine working with a more creative, hardworking, talented, and above everything else, passionate group of people. These are the folks that work day in and day out to make the progress that we've made in HIV disease. I love working with you all. I'm humbled by you on a daily basis. I'd like to recognize my other colleagues from academia, from the government, from the pharmaceutical industry. Oh yes, and of course the activist community. These national meetings, and the treatment activists are there, and I was drawn to them right from the beginning because it's pretty clear that they're the smartest guys, and I mean that in the most nice, non-sexist way possible, in the room. They always knew the most. I always gravitated towards them. They were the most interesting people to talk to, and clearly they were the only ones who got my show tune references ever. So I'd like to thank Treatment Action Group, really, for all that you do. If I had to sum up what activism is about, it's about getting people to do the right thing. And I had a great moment a year ago. I was stepping out of a meeting at the NIH, and Rob Camp from the Treatment Action Group was walking out with me, and we'd had a really heated discussion in the room. And he looked at me and smiled and said, "Trip, are you a closet activist?" And I smiled and I thought, activism is about looking in. It's from looking from without to within and getting people to do the right thing. And I thought what I've always wanted to be is an activist. But I did it a different way. I did it from the inside, getting people to do the right thing, looking out. So tonight, I'm coming out of the closet as an activist.